Welcome to another episode of the Market Makers in Middle East and Africa podcast. I am your host Abrar Hussain. Today I speak to Dr. Fatih Mehmet Gul, CEO at Fakeeh University Hospital and someone who is recognized as a top healthcare leader by Forbes in 2023 in the Middle East and Africa region. Dr. Fatih Mehmet Gul, welcome to the podcast.
Thanks for having me here, Abrar. I really appreciate it. Thanks for the invitation.
Thank you. Dr. Fatih, you are a physician and a healthcare leader leading one of the largest hospitals in the region. Tell us about your story.
Thank you. Thank you very much. First of all, I have to start from the early parts of the life, I believe. I mean, as the person, I love to care people from very early ages, and that is something inbuilt. So from that point, when you become a lover of care, you look for every single opportunity to care people. I remember even at the very early stages of my education, because of this care point, I have been always tasked as the head of the class. And then they asked me to look after the teams in the classes and then the other things. So then definitely all these journey has pushed me to get into the medical school. And I found myself in the medical school, and I loved the kind of life over there in the medical school. You're dealing with the patients, you're dealing with people who are frustrated and then looking for someone to help them. And the medical school was in Turkey, and then after the completion of medical school, I started seeing my patients. But later on, I also found out that the life is not only in the clinic. The area outside the clinic within the healthcare domain also needs something to be fixed. So then I found a very good opportunity and then started working dealing with a healthcare project. It was actually an oil and gas company's project over there in 3 countries. Then after that, I found myself actually getting another opportunity, working for a company dealing with the EMS services and then the air ambulances. And once I started actually managing and then delivering the services, later on got another opportunity in Saudi Arabia. Have worked with one of the very large companies in Saudi Arabia called Abdulatif Jameel. And definitely it was a school. It was a company who actually creates leaders. Abdulatif Jameel company has been managing mainly the car business, but beside that, they were also handling the social projects in the entire region, and then the healthcare projects next to it. So I became part of their teams, and then it was a school definitely. And in Saudi Arabia, while working with this company, it also helped me to create more networking over there. And I met with my current employer. In 2015, I joined to my current company, Fakeeh Care Group, which is one of the oldest healthcare companies in the region since 1978. But lots of pioneering and then success stories from medical point of view. The first IVF in Saudi Arabia, first CT in a private hospital in the western part of Saudi, first MRI, first PET CT, first LINAC. And today, the hospital group actually has lots of hospitals, outpatient clinics, medical school. It is an integrated healthcare system. My chance, the good opportunity for me was when I joined to the group in 2015, we were managing and focusing on mainly one hospital at that time. But this was the growth period of the group, and I had great opportunities actually to learn and also contribute. First, opening the outpatient clinic chain over there in Saudi, and then investing more in the technology, and then dealing with more corporate projects while the growth was happening in our group. But then afterwards, in 2017, I have been asked to move to Dubai, actually to manage the first overseas expansion of our group, transfer the brand abroad from Saudi, create the first hospital here, and which is the highest level of standalone hospital investment in the UAE, close to $500 million investment. Then I hired and met with amazing leadership team here, and today we have a beautiful hospital with brilliant people around, and I feel myself blessed working with these people here. And today our hospital here in Dubai is a full-fledged hospital offering tertiary care medical services, and then leading the healthcare market, changing the things. I can literally say that in just 2-year operation, we were able to implement several new things, which actually also pushed our other partner hospitals, I will not say competitor, so then, which also pushed them to get something in this regard, from communication till investment in technology and other things. And then we're glad to operate this hospital. So in a very quick nutshell, this is Fatih.
No, thank you. Thank you very much for sharing it. Quite a very interesting story. Now, my another question from this, what you mentioned, you started the Fakeeh University Hospital in UAE from scratch. Why you felt that this is the best investment in here, opening a hospital, and what opportunities do you see in UAE from that perspective?
As the group, we had more than 40 years of hospital operation experience, and then group today sees around daily around 7,500 to 8,000 patients, and then annually we're dealing around 1.5 million patients. So when you reach to this scale, you want to actually go to abroad, offer the kind of experience what you have to more communities, and at the same time tap into other markets from talent perspective, and also experience the other markets. When today we look at the entire region, you can definitely see a huge momentum in UAE. And as a company who has achieved lots of success stories over there in Saudi with a hospital group and an integrated healthcare system, the board has made the decision to bring this experience to UAE, be part of the UAE's growth, and then tap into the talent market UAE offers. On top of that, UAE is a platform also which facilitates you to become global, to become regional, which helps you to actually get into another level of the service of the company. So for that reason, UAE has been selected. And then in UAE, Dubai has been selected by our board. And that's why the investment has been made here in this part of the world.
Yeah, and starting something from scratch and making it successful in a kind of a relatively short time, how you manage to do it? What are the few things that you will recommend the listeners if they are starting an enterprise or a business or a healthcare unit, what they should do to make it successful, and how you did that?
Greenfield projects are always difficult, and especially if you bring a new brand to a new country. No one knows you. Yes, definitely. There were some people who have heard about our brand from our Saudi operation, but they did not experience this in UAE. So it was somehow unknown brand. And then we had to bring this entire investment here. So when we start this kind of greenfield projects, first of all, we try to understand the expectations of the community. Because at the end of the day, you're creating this for this particular community. We studied the community very well. Some of the investors, I can see that when they go to abroad, they simply copy and paste their local operation and think that this abroad or overseas expansion will work. Not just for our region. I mean, some of the US companies, they decide to expand to the UK, and then they simply implement exactly the same type of operation, and it doesn't work. And we also see some of the operations from Asia, they bring it to the Europe. Yeah. The same model will never work. So we as Fakeeh Care Group, first of all, we studied the needs and expectation of the community. And then we started formatting everything, all the services and communication from the beginning for that. Another important thing, what I have to mention, just before starting the operation and opening the doors of our hospital, we have spent a lot of time and worked very hard on talent marketing. Because healthcare itself is a people business. And you have to attract the best talent to provide the best service. Talent is available, but for this talent, if you want to hire them, you have to attract this talent. And since the beginning of our hospital's commissioning process, we have invested a lot on that. And I have to mention here, and then definitely others also could get benefit out of that, we simply opened our hospital through our investments on LinkedIn. We started communicating lots of things about our hospital, who we are, what exactly we're going to do, and what kind of ambitious plans we have. So then in LinkedIn, our number of followers for the hospital company page was more than 100,000 before opening the hospital. Then it paid off in one aspect. At the beginning, we had only 198 open positions, and we received more than 20,000 applicants.
Wow.
Applications were huge, and it definitely, gave us a hard task. But then it also helped us to handpick the best people out of this 20,000 applications. So then, that way we have started. Another important thing, from the beginning, we have identified what this investment is about and what it is going to offer and what is the definition of this hospital. So at the beginning, we have identified it in a very easy way with 3 pillars. We said that Fakeeh University Hospital, through our legacy, definitely, all our legacy helps us. We created these 3 pillars: academic care, care based on technology, and healing environment. Since the beginning, we started use these 3 pillars. Today, we are in 3rd year of our operation, and we did not change anything. And we keep the same motto, the same definition of our hospital. Today, if you come to our hospital and ask to receptionists, ask to security, ask to physicians or the nurses, just ask them, what is FUH? Tell me, define your hospital to me. They will tell you these 3 pillars. And with that way, we were able to also teach our people what it is about. Because if you don't set this yourself, every person will have their own definition, and you will not be able to give one language, one message to the community.
You spent time in Saudi, you spent time in UAE. Now, coming to Middle East and Africa region, how do you see the healthcare landscape? Where do you see opportunities? And where do you see that there are a lot of things still needs to be solved? So how will you explain that?
Healthcare is a social service. People will not get the healthcare service as a pleasure service. We are not hospitality services or the others. So for that reason, when we define the kind of social services, we have to first of all get the alignment with the main social service provider, which is government. We always sit together with the government, and then we try to understand their future strategy in terms of healthcare, in terms of the developments and the other things, and then we settle things in this regard. Today, when we look at the Saudi Arabia made it very clear with the Vision 2030 strategy documents and then the communication. We can clearly see that there is a very bright future for healthcare in the region. When today we look at the population of Saudi Arabia, the middle age, the average age of Saudi is around 32 years old, which is very young population, which means in future this young population will need lots of additional services, and that's what also governments are trying to settle things around. When we look at the UAE in the similar way, we have a young population. So in Saudi, definitely we have more larger population demography. You can see a large community of the elders, and then very large community of the children, and definitely the other demographies. In UAE, market is a bit different. Here, when we look at the entire population, we have an 11% of the community, which is local people, the Emiratis. And on top of that, we have the expat community. within the expat community, there are families, and then there are people who are coming here to work only as the expats. And when we look at that, it gives us a different demography. When we analyze the GCC healthcare needs for the future, today I can clearly say that the supplies are not enough, and then we need more and more supplies to answer the coming demand in the next decades. And healthcare is not something that you can establish it today and provide the service next year. Whatever you invest today, you have to keep in mind about the needs of next decade. Then you can structure things and then the services. From the Saudi Arabia, when you look at the private hospital investment, in last 10 years period, we did not have seen much of private investment in Saudi. That's why today the services are mainly offered mass services by the government hospitals and government healthcare providers, which means there's a huge room for the private investors, and which is already happening over there. When you look at today the main cities of Saudi, like Dammam, Riyadh, Jeddah, Medina, Mecca, and then the others, there are many new hospital constructions coming up from the current available hospital or healthcare companies, and also new healthcare companies are coming in, which is a good sign, which will definitely bring the new services, which will bring new additional talent to the country, and then will sort the current demand. When we look at the UAE is a bit more lucky, I can say. It was able to attract lots of investors earlier than Saudi, and today we have all these hospitals available in different part of the country for different kind of healthcare service needs. Still, there is a room for investment, and I believe government is already creating another strategy document. I have seen some drafts coming up. So soon, once this analysis document comes out, we will see more opportunities in UAE as well. But overall, when we look at the healthcare service offering for the region, there's a very bright future, and we need more hospitals, we need more talent, more medical professionals in order to offer this service for this young and growing population.
So future looks quite bright, Dr. Fatih. Now, coming to healthcare in general, you spoke about many times about technology, and you leverage technology to provide better care. How do you see technology changing healthcare? When we talk about AI is a buzzword now, metaverse.
Yes.
How do you see all those things changing the healthcare?
I'm happy to say that the first thing what we have looked at was the omni-channel communication with our patients. Previously, it was very conservative way. Each hospital, they operate a call center. Call my call center. Sometimes if you can reach to my call center, God helps you. So today, even we have hospitals like that. You call the call center and you will wait for half an hour minimum to reach to one person and then explain your need and then get your service. That was over. I mean, you can't ask a young person or any person today, call my call center and wait for half an hour to reach an agent, then you can get your booking. That's over. So we have worked on the omni-channel part. On omni-channel part, we have created an online booking through our website. We have changed all our websites based on what we have learned from the other industries and borrow some ideas from them. And then we created a mobile application, which then became the main communication channel between us and then the people. And the adoption, huge adoption. People love it. Simply, they can just log in and then see all their medical records, medical treatment plans, visits, XYZ, and they can also get the appointment from there. We have implemented a chatbot on our website, which does not necessarily actually creates a hassle, but then over there it just helps you to communicate with this chatbot and get your appointment immediately. The good thing what we have found, especially the mothers, because we track the data, they love to actually take appointment 3 o'clock morning, 4 o'clock morning, and simply get the appointment for the doctor from either mobile application or from the websites. Why? Because the child cries in the middle of the night, has a fever or other problem, then mother needs an appointment immediately to take the child in the morning, because it's not an emergency situation, but they want to visit the clinic. And we see this mothers, they log in the middle of the night and then get the appointment. I think that's because fathers sleep all the time. So then somehow, thanks to the mothers taking care of all the children, and then we created all these channels for people to get actually the services as easy as possible. Does the technology only end at this point? No. I mean, what we did, we also have looked at the patient journey from the home till the discharge of the patient from the hospital. And then we created the touch points over there. For each touch point, we sat together with the technology companies. And thanks to these technology companies, the global giant ones, they offered us solutions. They told us, okay, for this touch point where the patient comes to the parking, I have this solution that we are offering them in the hospitality industry. You can implement that. And then we have sat together with them about the medication dispensing. And then a large company told us, look, in FMCG, we have this robot. You can offer this robot, which will enhance your operation and improve the efficiency. We loved it, and then we implemented. Today, we have pharmacy robots in our hospital, which helps our pharmacists actually to dispense medication from the large cabinet. We call it as robot, and up to 4 medications, it can just dispense it in 50 seconds. So then our pharmacists, instead of going back and finding the items in the shelves, they can simply get it in the counter, and they can use the time for the pharmacy counseling, explaining how to use the medication and then the effects and then the other things. So we have implemented this solution. On top of that, let's say today in our hospital, you don't have a wet signature on a paper in the consent forms or in the registration. It's all on iPads. And we worked together with the company, and we created a solution again to make the life of our patient easier, and also create a paperless operation in the hospital. On top of that, the doctor signages are completely screens. The whole monitors are completely screens. Then on top of that, we made another interesting thing. When you got admitted in a hospital, we actually put the patient in a room, and overall, if you count the number of hours, either doctor or the nurse, we get into the room in total maximum like 2 hours with different frequencies and the times. So which means we put you in a room for 22 hours for you to wait over there, because we will take care of you. Fantastic. Okay, you're taking care of me. I appreciate that. But give me some services. So in this regard, we sat together with the hospitality industry. And thanks to some of the large hotel groups in Dubai, we sat together with them. And then we looked at their infotainment solutions. And again, with one of the techno giant company, we got one of these hospitality infotainment solution, and we added some medical data and then solutions into that one. And then we offered today in our hospital an infotainment solution to our patients admitted in our patient rooms, which helps you to see all the data on an iPad, again on an overbed table, easily. All the details about your doctor, about your nurse, about the treatment plan. That's one tab. If you move to the next tab, you can manage all your room controls, from curtain till the light, till thermostat and the others, without leaving your bed. And you can watch the TV, you can watch movies, you can watch Netflix or Prime, whatever you want. On top, you can order the meal, you can order amenities, you can watch the patient education videos, and then you can also share your survey results about your patient satisfaction through this. So then we implemented that. So technology, again, if we go back, is a long due implementation in our industry. Thanks to COVID, it actually helped us to reconsider, and also it helped us to convince our board members easier. Because that's another point. Sometimes you may think that it is a requirement, your board needs another kind of evidence or push. So then in the world, I believe boards have noticed that point, and now they are more supportive in terms of
the
technology investments.
Well, you really, I mean, it's quite impressive that you utilize technology in all the aspects of hospital setting and patient care. I was reading one of your article where you mentioned on LinkedIn compassionate care with technology. So I understand that you utilize technology. How do you bring that compassion, in the care or in dealing with patients, and how important is that in hospitals?
Healthcare, hospital is a people business. Again, let's go back to that. And we hire people, we treat people, we deal with people. And human being requires compassion. Human being requires human touch. People, when we actually first started communicating about the robotic surgeries and then the other thing, many people actually, they started sending us messages saying that I don't want to be operated by a robot. I need a person. I mean, don't leave me with a robot alone. And then I don't want to feel that this fiction story that I will end up, because after, the sedation, people don't want to think that a robot comes into the room and then operates them. We are actually in human operation. So for that reason, when you come to a hospital, you want to be treated with a smile. You want to be treated as a human. You want someone to help you. And that is in our DNA. As the caregivers, that's how we have been trained. Technology in healthcare, in many industries, it will also be the same way. I believe technology is a co-pilot, not an autopilot. So as the co-pilot, the technology will help our receptionists to offer faster and better service. It's already helping our pharmacists to spend more time with our patients. It's helping our physicians to spend less time with the computer, spend more time with the patient, and then offer more efficient surgery options, offer faster lab results, offer actually faster and more accurate screening results. So then this co-pilot option is going to help us everywhere in the hospital, including me as the hospital manager.
Thank you for sharing that, Dr. Fatih. Now, I saw another thing which is you're very passionate about, corporate social responsibility, and you started something called CSR Middle East. Can you share what is CSR Middle East and how the corporates can contribute more to the social cause?
Thank you. Again, coming from the care lover point of view, if we look at the care point, care is needed everywhere. Care is needed in the hospital, in the street, in social services, in the government side, in the corporate side, and everywhere. When I was actually reviewing the international practices of the corporate social responsibility, I have noticed that it is a bit missing in our part of the world. And that's why in 2005, I started this community called CSR Middle East. And I brought too many companies together, and thanks to the lots of large corporate organizations, they started offering some collaboration and collaborative projects on the other hand, because projects are there, but you need collaboration from different large groups. And also sometimes large groups, they also look for the ideas, what to implement. In Saudi Arabia, we were actually glad to be part of many projects with the CSR Middle East. In UAE, we were glad to have lots of actually networking meetings and also the conferences and seminars discussing what else we can do better, from the community initiatives till the environment projects and then the others. So this became somehow something that I believe in my hobby, that I would like to support whoever wants to work on this front. For that reason, today I'm glad to tell you that our hospital investment is a LEED Gold hospital, which is the first environment-friendly hospital setup. And then our hospital became the first private hospital in the project called Terra Carta, which is a sustainability project of King Charles III. So then we will continue to work on this front. And in each town hall meeting and discussions with my people, I also share this point, asking them actually to look for the sustainability ideas and to live with thinking that we should not damage the environment and the others. And there is another very important point I think it is worth to mention. When we open a hospital, we open it to actually care people and also somehow work on the healing of the communities. While healing the community as the organization, we cannot actually consider damaging the environment. And we should also consider healing the environment, which will definitely contribute healing the people and community. So then it worked fantastically altogether. And that's why I love CSR. Today the name is ESG and then sustainability, you name it. But it is all about the community initiatives.
Yeah, and I think this is very important nowadays. And I feel this found its right movement.
Very
Sustainability is getting discussed at the board level, and there are a lot of initiatives. My last question, Dr. Fatih, and it's a pleasure to have you. What are the good things of being a CEO and running a healthcare organization?
Well, being a CEO gives you lots of responsibility, but at the same time, lots of tools that you can change things and then create positive impacts in the people's lives. Sometimes in some organizations, such great ideas, unfortunately, are going to be lost because of the lots of bureaucratic levels. Being a CEO helps you to pass these kind of bureaucratic things and then touch to the people's lives and then create more positive impact. That is what I love being a CEO. And also it helps you to meet with amazing talent. If you're a CEO, you receive lots of emails about sharing the ideas, reaching you, and then discussing different things in different levels, which helps me to learn every day. Otherwise, I mean, if you just deal with the physician task within your clinic, such ideas and such people are not that much diverse. Then it helps me a lot to learn every day. And I'm a learner. Every day I love to learn more. And this is what I like and love by being a CEO.
Yeah, and thank you for sharing and coming to the podcast. I think you're making a great impact, Dr. Fatih, and running a hospital is like a community service and helping the community. So thank you for doing that. And it's really a pleasure to host you and to talk to you.
It's my pleasure. Thanks for having me.
Thank you, Dr. Fatih.
Thank you very much.